I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us today. Now, you may think that osteoarthritis affects only us older folks, but even folks in their 40s and their 50s can be affected by the disease. Now, there's a new survey out that finds that many women with significant hip or knee pain are essentially living their lives on pause and giving up activities that they normally enjoy to avoid triggering the pain. Joining us now with information about joint pain are orthopedic surgeon Dr. David Fisher and his patient, Lonnie. Welcome to Health Professional Radio, Dr. Fisher and Lonnie.
Thank you.
Thank you. Thank you both for joining us today. Dr. Fisher, you're an expert in osteoarthritis, basically an experienced orthopedic surgeon. Why is it that so many women, as I said, put their lives on pause because of this type of pain?
Osteoarthritis is a condition that gradually leads into your life, basically. It starts off with an ache or pain that can increase, causing swelling, giving way, or buckling of the joint. It can interfere with your ability to do certain things, such as getting up from a chair, going up and down steps, walking across the floor. And gradually, it'll impact the activities that you do on a normal basis. The survey that was done was sponsored by Depew Synthes, for whom we're here today. Basically, it looked at over 500 women who had undergone hip or knee replacement or were about to, and they were all in the ages of 45 to 65 years of age. Those patients reported having lived with these symptoms for a long period of time and felt like they had really put their life on pause because they couldn't do the things that they wanted to do. And so at some point they went about, and the people had treatments of various kinds until ultimately required joint replacement to provide pain relief and improvement in their function.
Well, obviously, dealing with it for a long period of time is much too long. When is the right time to see a doctor when these symptoms present?
Osteoarthritis is the most common form of arthritis that we see. It currently affects approximately 30 million Americans, and that number will likely double in the next 15 years as our society gets older. It's a gradual wear and tear of the joint and can lead to symptoms that as I said, start off early with mild aching, can progress where you get more significant symptoms, and as it starts to interfere with your quality of life, whether it's sporting activities, social activities, work activities, or even just activities of getting up and around, you probably need to see your primary care physician, get an x-ray at some point, and if there are arthritic changes, you should seek treatment for those problems.
Some of that treatment does include surgery, am I right?
That's correct. Early on, we can treat it with medications, some of which can be obtained over the counter. Those prescriptions can be for arthritis medicine. Sometimes physical therapy, injections of different medicines into the joint may provide temporary relief. So we try to treat the symptoms non-operatively as long as we can, and when they become intolerable, surgical options are available and can be very effective at providing pain relief and improvement in function.
Now, Lonnie, as a patient, a woman specifically suffering with osteoarthritis, as I said, it doesn't just affect older folks or people that aren't active. You were quite active when your problems began. What was it like living with the pain, and why did you decide to have joint replacement surgery?
It's very difficult living with the pain and progressively losing your ability to do just daily tasks at work, at home. For me, riding and training my horses and jumping them is very important. And I was just gradually losing the ability to do any of that due to the pain. I had tried all of the supplements. I've tried the anti-inflammatories, the joint injections. The pain was just to the point where I wasn't able to deal with it at all. It was keeping me up at night. And so I went to my primary physician, who in turn sent me to Dr. Fisher, where we decided, after looking at the radiographs and talking about the severity of my problems, of just having both of my knees replaced, because there really weren't any other options available. And now I can get around, I ride my horses, I jump them, I do all sorts of gardening. My life is much, much better, and I just can't recommend it enough, at least for me. It was definitely the right decision to make.
Did you have both of your joints replaced at the same time, or was there a healing period for one and then start on the other?
I had both of them done at the same time.
How was the physical therapy? How would you describe it when describing it to someone else who might be considering taking the option that you did?
Initially, like with any kind of rehabbing, it's going to be a little bit painful, but for me, keeping on the rehab schedule, I was very, very pleased with how things went, and within 8 weeks, I was back riding my horses again.
Right. Now,
so it was definitely worth it.
Now, Dr. Fisher, in your experience, is Lonnie's experience typical?
Yeah, absolutely. Her experience is very common. I see that every day in my office where people tried to put up with symptoms. They have this ongoing deterioration of the joint to where it ultimately affects their quality of life. And as it starts to affect your quality of life, then you get serious about what can be done about it. And the joint replacements, and Lonnie can attest to this, 4 out of the 5 of the women in this survey that had their joints replaced wish they had done it sooner. And Lonnie's had a hip and both knees, so she's been through this a couple times, and her results are outstanding. Patients do get pain relief, and their return to activities is remarkable.
Now, Lonnie, what advice or maybe some resources can you offer to some other women who are going through the pain that you did and maybe can benefit from the procedure?
Sure. First thing you'd want to do would be to contact your primary physician to discuss the problems and what your options might be. Mm-hmm. Most people, they're going to have the joint replacements. Obviously, they're going to end up going to see an orthopedic specialist.
Mm-hmm. And Dr. Fisher, in wrapping up, where can our listeners go and get more information about osteoarthritis and specifically how it affects the lives of women who are suffering?
Yeah, people can go to the website, timetohitplay.com, to learn more about arthritis and the surgical options that are available, as well as medical treatment potentially that can be done for treating this condition.
All right. Well, I thank you both for joining us today. Appreciate it.
Thank you.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud. Join us on YouTube, follow us on Facebook, and visit our affiliates page when you visit hpr.fm and healthprofessionalradio.com.au.